My name is Joey Alvarez. I'm with 12 Stone Health Partners. Anybody heard of 12 Stone Health Partners? Handful. All right, very good. If you remember the pharmacy Reeves Sane, we're kind of an extension of Reeves Sane Pharmacy. We've been here 40 years. Now, infusion centers aren't 40 years old, but that's kind of a new thing in the last 7 years or so. My role is not to be a public speaker, and I'm not a professional speaker. In fact, I worked with a good friend of mine for a long time in the pharmacy. I've been in the pharmacy 16 years, so I've been there, done a lot of different things with the pharmacy. But I worked with a good friend of mine, and he would do all the talks, and I just sit back and listen. I'm like, man, he's such a good speaker. And I'm like, so I said, man, what makes you such a good speaker? He says, well, my dad's a preacher, so I just been around it my whole life. You know, I've been on stage since I was little, doing different things at church. So my dad was a butcher, so I hope I don't butcher this. So let's start out with some facts about Alzheimer's. All right, what I do in my role every day is do different. I walk in doctor's office every day and tell them about all our infusion services, and we do bunches of drugs that we infuse for several different disease states. So Alzheimer's just happens to be one of the disease states that we treat at the infusion center. So by no means am I an expert or professional. These are things that I've learned from studying Alzheimer's. We're going to focus on Alzheimer's disease. It is a type of dementia, and I'll explain that in the presentation. But there's multiple types of dementias. Alzheimer's is one. It's probably the one that's mostly studied. So this is really just from the research I've done and the learning, and I go to seminars and education just like you guys are here today to do that. So let's start out with some facts. Nearly 7 million Americans are living with Alzheimer's, and that's just Americans. 7 million. That's a bunch. And I have experienced it personally in my life with my grandparents and now my mom. So it hits deep in my family, even through my extended family. I'm sure everyone here has been touched with Alzheimer's in one way, shape, or form. The lifetime risk for Alzheimer's at age 45 is 1 in 5 for women and 1 in 10 for men. And that was a stat that got me because I thought it was kind of flat across the board. So it obviously affects women more than men. So 1 in 10 for men, 1 in 5 for women. Older Black Americans are 2 times as likely to have Alzheimer's or other dementia than white men. This one really got me. Between the year 2000 and 2021, deaths from heart disease have decreased 2.1%, while deaths in Alzheimer's have increased 141% in just those 11 years. Now, as I started thinking about that stat a little bit more, I think the reason that number is so high, we've learned so much in the last 21, 24 years, since 2000, about Alzheimer's. Y'all, the research that is going into Alzheimer's has just been very impactful in the last quarter century. So I think that's a stat that you could look at it as skewed, only because we're learning so much about it right now. 1 in 3 seniors die with Alzheimer's or dementia. That's a bunch. Alzheimer's kills more than breast cancer and prostate cancer combined. Older Hispanic Americans are 1.5% likely to have Alzheimer's or other dementia than whites. That was a stat they got. So, just some facts that I came across I thought it'd be interesting to share, but those are some big numbers. And all right. These are things we're going to be talking about. We're describing Alzheimer's disease, recognizing the symptoms of Alzheimer's, identifying the causes of Alzheimer's, understanding therapy options for Alzheimer's, and there are finally therapies that does not cure Alzheimer's, but there are ways to slow it down. We'll talk about that and reviewing the new therapies for Alzheimer's disease. All right, Alzheimer's versus dementia. This is a question that had me, and I didn't know until I really dove into it. Anybody know? Just quick answer, one answer. All right. Dementia is, think of it as like an umbrella. It is all things cognitive impairment. And Alzheimer's is just one of those things. Dementia is a collection of symptoms related to cognitive decline. And cognitive decline is things simple as forgetting an appointment or forgetting to take your medication. What my mom has done, forgetting to turn the stove off. Those are cognitive impairments, examples of. All right. Think of kind of another example of dementia and Alzheimer's. Think of dementia as an automobile. Automobiles have 4 wheels, 4 tires, a steering wheel, a windshield, a gas tank, a hood, a trunk, right? That's an automobile. And there's thousands of automobiles. But if I say Mercedes, you start looking at the automobile a little different, right? You kind of have an idea what that automobile is. Or if I say a Ford, you start thinking that's a different kind of automobile. So think of Alzheimer's and dementia in that form. Dementia is everything, cognitive impairment, and then you have Alzheimer's. And that's what we're really going to be talking about is Alzheimer's. And the question came up earlier, we're going to be talking about all dementias. Well, Alzheimer's is the one that is probably the vast majority of the dementia, and it gets studied the most, has the most funds going to it. So it's getting studied the most, but there's definitely, across the board, they're all being studied and try to have things to cure it. Here's another way to think about what specifically Alzheimer's is. Everybody had a VCR one time, right? Think of having a VCR tape and you are erasing that VCR tape backwards. That's Alzheimer's. Now think about that. So if you have a VCR tape and you start erasing from the newest portion of it, that's Alzheimer's. So a person with Alzheimer's may remember that yellow dress her friend wore in 3rd grade, but she may not be able to remember what she had for breakfast. In fact, she's probably thinking, someone's starving me. I haven't even eaten today. So erasing that information from your brain, from the newest information you've learned, slowly decreasing it back to then. So that's kind of how you know, a lot of folks with Alzheimer's can remember things in the past, but they cannot remember things that just happened today or minutes ago. You can see how that can impact your daily, day-to-day life activities. All right, so basically Alzheimer's is the inability to retain information or remember it significant enough to interfere with day-to-day life activities. So you see how important this is to diagnose early, y'all. I mean, these are things that you need and are impactful for today. All right. And here, we talked about the U.S. population with Alzheimer's. Here's the worldwide number right here, 24 million. I'm going to use the pointer here. Can y'all see that? So this is how the disease starts. It starts, let me get on this side, I can see better. Mild, right here. Usually not diagnosed at this point because you're not forgetting a lot of things. You may forget I have forgotten to turn the stove off, right? We've all done it. But it starts becoming more common right here. And this could last 7 years and you don't even know it, right? But that is the early signs of dementia. And as it continues, it starts taking over this backside. And I'm not clinical, but there's some clinical terms in here that I wrote down. The lateral temporal and parietal lobes back here, about 2 years, and then it starts going towards the front of the brain, the frontal lobe, and then severe Alzheimer's at the very end, the occipital lobe. Anybody say that? I can't say it. And this is all from the Alzheimer's, information I got is from the Alzheimer's Association. And if you guys, the Alzheimer's organization does a fabulous job. You can get on their website and dig in, and they have information and support and resources like no other. And there's also a local chapter, it's not connected to Alzheimer's Association, there's a Tennessee Alzheimer's that does a fabulous job locally. All right. Causes of Alzheimer's disease, less than 10% of cases occur before age 65, so it's a very small number before you're 65. Affects 1 in 3 people 85 or older. And genetics. You know, I always thought, well, Alzheimer's runs in my family. It's a genetic thing. You know, both my grandparents had Alzheimer's. My mom has Alzheimer's. I've had aunts and uncles. I'm like, it's in my family. But actually, from case studies, there is no signs that it is genetic. Today, we do not know that today. So it is not a real thing that we know of. So just because when your parents had it, your grandparents had it, does not mean that you're going to get it. But things that have been found could lead to Alzheimer's is on unmanaged chronic health issues, physical inactivity, I think is a big one, unhealthy diet, alcohol misuse, smoking, poor sleep habits. This is what I'm bad about, poor sleep habits. You know, I think I'm full of energy and I can just go. And personally, my doctor recently was talking to me about my sleep habits. He's telling me how important sleep is. For those that say, well, I just get up early, the sun comes up and I get up. He said, that's what my excuse was to him. Sun comes up, I just get up. He says, put some black curtains up. That's just because the sun's up doesn't mean you have to get up. And he actually put me on a CPAP machine. And that has been life-changing. This is not even have nothing to do with this, but that has been life-changing for me. If you're not getting good sleep, please see your doctor and talk to them about that. Because I truly believe now that sleep is so important. Social isolation. Stay networked. Stay connected with your friends. Stay connected with your family. Lack of mental stimulation. You know, I think about my mom, and she has just drawn herself back from being stimulated and reading, and she used to do all this stuff. Now she just watches TV and she doesn't want to get out. So I try to get her out myself and get her involved visiting family members and all that. So, all right. Treating Alzheimer's disease. There is currently no cure for Alzheimer's disease. 1996, I believe, was the year. Some of these drugs, traditional focused drugs, everyone's heard of Aricept, Exelon, Razidine. Those have really just been treating the symptoms, right? They've been around for a long time. So from 96 to recently, we've just been treating the symptoms. Namenda was another one that came in. And these are really just antidepressants, anti-anxiety drugs, antipsychotics, and they had a lot of side effects. And that's okay. I mean, all drugs have some sort of side effect. We understand that. And they've done a good job treating the symptoms for many years. I tell people, be forthcoming with your physician. Be honest. You want to catch this early. You want your loved ones to catch this early. You know, I think it just has a stigma of no one wants to admit they may have Alzheimer's. But there's treatments now, and it's important to catch it early. And we'll talk more about that in a minute. And if your physician kind of blows you off a little bit about your concerns, find another doctor. All right? Doesn't mean you can't see that same physician you've been seeing for 40 years. He or she may be good at other things, but if they're not interested, there's many doctors that are just not interested in diagnosing this. They just kind of blow it off. but they just don't understand there's treatments now. And then if your primary care physician, if you see your primary care physician and he or she says, you know, we may have something here, encourage them to ask you to see a neurologist. Now, neurologists they're the ones that are probably going to diagnose this disease for you or your loved one. And we'll talk about more ways how they do that. But we're actually I feel like a desert of neurologists in this area. There's just not that many. And for example, my mom took 6 months to get a neurologist appointment. So, and 6 months is a long time with this disease. So I'm trying to say all those things just to impact you and understand that it's important to get to the bottom of it quicker than later. Be an advocate for yourself and your loved ones. Not all physicians understand aging. Let's talk about, this is kind of some neat pictures, also from Alzheimer's Association. This is a healthy brain. See how nice and full it is on the left? This is a brain with Alzheimer's disease. And what's happening is these amyloid plaques, which are proteins that attack the brain, and they start shrinking your brain. Think of a spider web. They start taking over the brain, and they start shrinking it. And over time, remember the earlier slides I showed where they attack the back, and then the front, and then the other areas of the brain? The tau plaques. You probably hear that word a lot. Tau and the amyloid plaques. Just start like a spider web. They start attacking and spreading, start eating your brain. So back to the neurologist. A neurologist can do a lot of things. They can do a more in-depth cognitive. Your primary care physician can do a cognitive test, but neurologists have some physical cognitive tests that they're able to do. Actually, when we did the health fair, we did we set up a booth and did a mini cognitive test. Anybody do that with us at the health fair? It was fun to do. It was just it was like a 3-question, but that's the simple cognitive test. And I gave everyone a score who did it, and some of them were shocked, and some were like happy when they were leaving. So. The future looks bright for Alzheimer's. There are 164 drug trials have started this year. 164 potential new drugs have started this year. And there's 33 new drugs in the pipeline to try to get FDA approval. Some won't make it, some will. They're all in studies. This is what I think is the neatest thing. So currently right now, a neurologist can do a lumbar puncture, get fluid from your spine. Doesn't sound fun, right? And they can test it that way. They can do a PET scan on your brain. They can see the plaque on your brain. So the test that they're working on right now is a simple blood test to identify if you have Alzheimer's. A saliva test. Wouldn't it be nice just spit in a cup and know if you have Alzheimer's? That's huge. What was the other one? Drug. Yeah. Saliva, blood. Skin test. They can scrape a little piece of your skin. That'd be lumbar puncture or blood test. Hello. Like I said, the future looks very bright for Alzheimer's. All right, so we talked about the drugs that treat the symptoms. That's been around for a while. Here are 2 drugs for treating Alzheimer's. And these are slow the progression of Alzheimer's, but they must be caught, Alzheimer's must be caught in the early stages. Currently, these drugs do not treat the late stages of Alzheimer's. Neither are they a cure, so I want to make sure that's clear to everybody. They target the beta amyloid proteins in the plaques, indicated for patients with mild cognitive impairment and dementia due to Alzheimer's disease. Both of these drugs were studied 18 months, and both demonstrated clearance of protein and plaques and slow progression of early Alzheimer's disease. I think the number is like 28% I think the drugs are 1% off, 27, 28, or 28 and 29. So that's a significant number in reduction of more quality of life for folks with Alzheimer's disease. It must be infused in an infusion center currently. You can't take it at home, but it has to be infused at a center. Some drugs that we do can be done at home. That's all done. Usually it's done in an infusion center because there might be a higher risk of something. So we have a nurse practitioner or somebody watching that infusion being taken place. The names of the drugs are Leqembi. Leqembi came out first about a year and a half ago. And then Kisunla was just approved this year. And so those are being infused today, both of those. Specifically, we'll start with Leqembi because it was the first one. IV infusion every 2 weeks. The infusion is 60-minute infusion plus an observation time. So you do your infusion for 60 minutes, then you have to sit and wait, make sure everything looked good. Kisunla is an infusion every 4 weeks. It's a 30-minute infusion with a 30-minute post-infusion observation. And both of these attack those plaques. So with every drug that we talk about, we should at least talk about the potential side effects. And if I did have one little Leqembi form up there that I had, but it goes in depth. And you can also look up the websites, but it'll share all these in more detail. Common side effect, usually no symptoms, but serious symptoms can occur. Swelling or bleeding in the brain. And this, I'll tell you what I learned. So when I heard bleeding in the brain, I'm like, that's terrible. Well, bleeding of the brain does not necessarily mean they have to stop the infusion. It's not, I think the doctors would make this determination, but it's not completely abnormal for your brain to bleed, which I thought, my brain is bleeding, that's terrible. But the doctor would make that decision, and you and your doctor would make that decision. But that is a symptom that can occur. And that's the reason they do PET scans through every few months during having those infusions. Other symptom, it says it can be fatal. Other symptoms, headache, dizziness, nausea, difficulty walking, confusion, vision changes, and seizures. So monitoring, you're going to have blood work along the process of having these infusions and the PET scan MRI like I mentioned earlier. Other possible side effects, serious allergic reactions, infusion-related reactions. And that's why we do these in infusion centers. You can have headaches, chills, sweating, nausea, vomiting, difficulty breathing, chest pain, irritation of skin, flu-like symptoms, and changes in heart rate. I want to wrap up with just some healthy habits. Protect your head. If you're struggling to get around the house sometimes, probably not a good idea to go snow skiing, right? Trip hazards in the home. Make sure there's no cords, extension cords, especially around Christmas time. Make sure there's no extension cords running around the house. Just be careful. I try to do this for my mom. My mom lives with me. And I try to give her as much open space as possible with, I've moved everything out of the way, y'all. There's just nothing in the way. The bathroom I took the door off the bathroom. That way she can just walk in the bathroom. So I make it as easy and comfortable for her to get around with any changes or possibilities of falling, because a fall and hitting your head would not be good. Be smoke-free. That doesn't just apply to Alzheimer's. That applies to a lot of diseases. Challenge your mind, y'all. Crossword puzzles, Sudoku, word searches, reading. Try to learn something new every day. Y'all, we have access to the most information on the planet as we've ever had. Get on YouTube. Learn about something you've always wanted to learn about. Watch a 10-minute video every day. Learn about something. Challenge your brain. Control your blood pressure. Back to quality sleep. Important. Eat healthy. Again, not just for Alzheimer's, that goes a long way for many things. Manage diabetes, maintain a healthy weight. This is a number I thought was pretty neat. Up to 40% of dementia cases can be prevented or delayed by targeting these healthy habits. That's a huge number, y'all. 40% by just doing those simple things that we should be doing already, right? Eating healthy, sleeping. That concludes what I want to talk about. I'm willing to answer any questions. Here's a few things about 12 Stone. We're right here on Northfield Boulevard. We are an infusion center. We treat lots of different diseases. You're welcome to, you have my cards up there if you guys ever want a tour. Be happy to share it with, show you around. If you ever want to use it in the future, we'd love to have you. We're accredited by pretty much everybody that can accredit us. I mean, it's a spa-like feel when you walk into 12 Stone. We have about 21 locations. Many of those are in Tennessee. We have a few in Kentucky, a bunch in Georgia, and Virginia. But it's pretty neat. We started right here in Murfreesboro, and this is our flagship pharmacies right here.